outline the movements in the upper limb. The first movement occurs at the sternoclavicular joint, and the whole pectoral girdle moves around the sternoclavicular joint. There is elevation, depression, protraction, retraction, rotation, external rotation, and derotation. So, what are the scapulothoracic movements? Elevation, depression, external rotation, derotation, protraction, and retraction. All these movements would be produced by muscles that attach the trunk to the scapula. So the muscle that elevates is attached to the superior part of the spinous process, and it's called as trapezius. The main muscle that elevates. But there's also one other muscle, the levator scapulae. The muscle that depresses is attached to the coracoid process. So the lower fibers of the trapezius and the pectoralis minor depress also. And pectoralis minor, they depress. The external rotators are around this axis, and this axis is passing like this. So the rotation of the scapula is like this. And this is produced because this is the scapula. Here is the glenoid cavity. So the fibers of the trapezius lift this portion of the scapula up, and the lower fibers of the trapezius put the scapula, this part, down. So around this axis, going from here to the sternoclavicular joint, there is external rotation of the scapula. The pectoralis minor, attached from the coracoid process to the ribs, would cause derotation of the scapula. So the coracoid process, which is somewhere here, when it is depressed, it will cause derotation of the scapula. The external rotation is by trapezius, helped by a muscle which arises from the medial border, comes round and gets attached onto the rib, and this muscle is serratus anterior. So external rotation, trapezius plus serratus anterior. Derotation, pectoralis minor. Protraction, serratus anterior. Retraction by the rhomboidus major, minor, and major, and medial fibers of the trapezius. Medial fibers of the trapezius. So rhomboidus major, minor, and the medial fibers of the trapezius. So you would remember that the scapula moves on the chest wall, and the movements are elevation, depression, external rotation, derotation of the external rotation, protraction and retraction. And the most common muscle you are supposed to recognize is serratus anterior patellaris, where there is winging of the scapula. You ask the person to push forward, and the lower angle of the scapula becomes prominent, and that is called as winging of scapula. So we covered the scapulothoracic movements. I want to study the scapulo-humeral movements. The scapulo-humeral movements. Now we go on to study the scapula and the humeral movements at the shoulder joint. So movements of the shoulder joint. One is along the antero-posterior axis, passing at 30 degrees to the shoulder, and that is abduction. The second is adduction. The third is internal rotation. The fourth is external rotation. And this is on the supero-inferior axis, on this axis. And then on the side-to-side axis, there can be a flexion or an extension. So basically the movements are abduction, produced by the deltoid and the supraspinatus, deltoid and supraspinatus, and after 90 degrees the scapula externally rotates to make the abduction 180 degrees, and that scapular external rotation is produced by trapezius and serratus anterior. So the serratus anterior would pull this forward, and the trapezius would rotate the spine of the scapula like this on this axis, so that there is external rotation. So this is abduction. Adduction would be produced primarily by all the muscles that form the anti-axillary fold, which primarily means the pectoralis major, which is winding around itself. Then from the coracoid there is this coracobrachialis, which is attached to the middle of the medial border of the arm, and all the muscles that are forming the posterior axillary fold, where The lower border, on the lower border of the teres major, you have the winding of the latissimus dorsi muscle. So the muscle forming the posterior axillary fold and the anti-axillary fold basically will adduct, and they basically replace the original adductor, which was the coracobrachialis. So adduction, pectoralis major, latissimus dorsi, teres major and minor, and infraspinatus behind would adduct the shoulder, the scapulo-humeral joint, and with this there was an original adductor, that was the coracobrachialis, which corresponds to the adductor longus brevis and magnus of the lower limb. So this coracobrachialis sometimes has a foramen here, and there is the projection of the humerus at this point called the humeral spur, and the insertion of the muscle can converts into a ligament which connects it to the medial epicondyle. Now it has become like the adductor magnus, and this ligament is called as the ligament of Struther. The median nerve and the brachial artery will pass through this foramen and may get compressed. The brachial artery and the median nerve may come from behind the coracobrachialis, pass through this foramen, become anterior, and this, when they are compressed, the artery and the nerve, it is called as Struther syndrome. So that is the applied importance of coracobrachialis. So you've covered the adductor and the abductor. Now all the muscles that are attached to the we'll turn it like this. All the muscles that are attached to the lesser tuberosity and the bicipital groove will rotate it internally. So the first is the subscapularis, then is the pectoralis major, and then is the lady between two majors, latissimus dorsi between teres major and pectoralis major, and then all these muscles will internally rotate. So subscapularis, pectoralis major will internally rotate, and all muscles attached to the greater tuberosity, which is the supraspinatus, the infraspinatus, and the teres minor. The sit structures will externally rotate the scapulo-humeral joint, the supraspinatus, infraspinatus, and teres minor. So this covers internal, and external rotation. No reason for you to try to learn it up by heart. So adduction, abduction, external, internal rotation. And now all muscles, the pectoralis major will flex, the deltoid arising from the lateral side of the anterior border of the clavicle, the acromion process, and the spine of scapula up to the deltoid tuberosity, attached to the deltoid tuberosity like this. This muscle, this deltoid will abduct, but the anterior fibers of the deltoid will flex. Is divided into three. Anterior fibers flex with the pectoralis major. Posterior fibers extend. Latissimus dorsi extends. And middle fibers of the deltoid, these ones will abduct. Posterior fibers extend and middle fibers of the deltoid will abduct. So we covered abduction, adduction, external rotation, internal rotation, and flexion and extension. Latissimus dorsi coming like this. Latissimus dorsi and the deltoid extensor fibers will extend. The importance of latissimus dorsi is that it extends with the arm totally abducted. So it's the muscle you use when you are doing pull-ups. So latissimus dorsi is a very powerful muscle, and you test it when you can pull something down from overhead. So that is the latissimus dorsi. So on the shoulder we have covered abduction, adduction, flexion, extension, internal rotation and external rotation.